Every Thursday now, we're featuring one of the top infectious disease doctors in New York State. He's Dr. Rajeev Fernando, and he joins me again this morning to answer some of your questions. You can always get a question in. You can use our mobile chat on your Kicks 1055 mobile app or 1-877-303-1055. Just give me the question. And we've got a few to ask Dr. Rajeev today. And good morning, Doctor. Thanks for being here.
Thank you so much for having me.
All right. So we are now experiencing, I guess, fourth or fifth week of social distancing, of staying at home and all that. And we're going to answer some questions from some of our listeners that they've gotten into us. Jennifer in New Milford wants to know, how long will we have to social distance after the curve finally levels off? What's your thought on this?
Hi, Jennifer. Great question. I think we're really in for months of social distancing. Remember, as soon as it's the peak that we reach, but if you look at all the curves around the world, you're going to see, the curve gets flattened, but it goes on for a while. So I hate to bring up this kind of news, but I think at least 2 months at the very least. It's also, let's just extrapolate this from China. This started in China in December, and here they are right now also still social distancing. So we have a big country and really just a small hold, really. Like, a couple of mistakes here or there could really change everything. Like the first case that came into New York, a passenger from Doha, Qatar. She came into New York as a traveler. I'm not sure whether she was followed well enough, So these kind of small errors, let's say New York actually really followed her well, but, all it takes for them is to miss one person or one case, and that's a big problem. So these pandemics are very serious business, and I think if you come out of social isolation quicker than what you should be, that's when you're going to see like a second peak of acute cases. So I'm so sorry to break this, but, I think governments have been kind of hopeful and saying, it'll end soon. But in my personal experience, I think it's going to be a while.
So a few more months at least. I
think so.
At the bare minimum.
Yeah, I think at least another 2 months. That's what I feel. If we don't do it, we're going to have a second peak. And yeah. I'm in New York right now. And I think, I talk about New York because we've made a lot of mistakes here, slow to act. And now we're, working with the government and FEMA to start up an overflow hospital. So I want people around the country to really look at the mistakes New York has made. I love New York City. It's my town. I will never, say anything against it. But I want people to learn from these mistakes, observe them, and, get prepared early in social distancing so all this doesn't happen in other states around the country.
This next one is from Rich in Carmel. He got through to us through our Kicks 1055 mobile app, and he asks, can you get the coronavirus again once you've had it?
Great question, Rich. Thanks for tuning in. It is possible. So there's one possibility. If the strain stays the same, it'll just die off, and that's what happened with SARS. The other possibility is if it starts to mutate and different strains happen. Let's compare this to influenza or the common flu. The reason the vaccine doesn't work so well every year, it's about 40% efficacy. The one thing I like about the vaccine is that even people tell me they get the flu, they got the vaccine, but they still got the flu. The answer is the vaccine really prevents the complications of the influenza or flu. So and you can see every year it changes. The vaccine efficacy is as low as 40% sometimes. So if the strain does mutate, that's what's possible. So there's really two pathways. One is it can just die off, can become a part of the community. The community builds up immunity, and so does the whole city or town at some point. That's one possibility. The other possibility is, like you said, we can get reinfected with a new strain.
Okay, and finally here from Gina in Danbury. She says she's been hearing a lot about this hydroxychloroquine on the news. She asks, is this something that's actually safe to take?
Yeah, that's a great question. And I don't think hydroxychloroquine is a safe drug to take. It has a lot of side effects. One of the things is it can cause an abnormal heart rhythm, or what we call an arrhythmia. So it's very important just not to just pop a pill. Talk to your doctor about it. If you have other medical conditions, you should definitely talk to them and see whether it's safe to take in the outpatient without consulting your doctor. What we usually do in the inpatient setting is we get a baseline EKG just to make sure these intervals are normal, and then we go about taking it.
Okay, well, I think we've got some interesting answers to some great questions there, and I appreciate your time. I'll get you back. I know you're on the front lines today, and we'll keep those questions coming for next week during our segment. And thank you so much, Dr. Fernando, for being with us.
It's my absolute pleasure. And, yeah, please keep me, even during the week, if you have any questions. I love giving education to the community, so please hit me up for anything. Stay safe, Connecticut.
All right, that is Dr. Rajeev Fernando, one of New York's top infectious disease doctors. And if you have a question, let me know. You can call me here anytime, 1-877-303-1055, or you can use the mobile chat on your Kicks 1055 mobile app. Just type in a question and send it to us, and we'll make sure we get that to Dr. Rajeev Fernando next week, and he'll answer your questions right here at Kicks 1055.
We're always up to something. Check us out at Kicks1055.com.